this morning si Dr. Maria Adelwisa Belen. Ayan, siyang orthopedic surgeon naman. Ayan, upo po kayo, ma'am.
Morning! Welcome po sa bahay ni Kuya.
Ayan.
Morning, Doc.
Hi, morning. Ayan. Ang pag-uusapan kasi natin ngayon with Doc is yung osteoporosis. Ayan.
Yes.
Oo. Ito kasi yung mga pag nagbe-brittle na yung mga bones natin, di ba? Yung weakness ng bones. Pero kindly explain po, bakit po nagkakaroon ng osteoporosis ang isang tao?
Okay. First, we have to realize that bone is a live tissue. Buhay siya. Hindi siya yung pag pinanganak tayo, yun na, o pag after we've stopped growing. So, everything in our body is about balance. So, it's sa bones natin, it's a balance between bone forming and bone resorbing cells. So, it's a constant cycle throughout life. When we reach around the age of 20, yun yung peak bone mass natin. And then, aside from that, maraming factors that can affect our bone mass. So, age, level of activity, diet, and then there's a portion na genetic. Although
Maliit lang.
Maliit lang. It's more on yung tatlo na factors. However, meron ding iba na may medical conditions kasi that are more at risk for osteoporosis.
Doktora, tama ba ako na hindi lang babae yung nagkaka-osteoporosis?
Yes.
Kahit lalaki. Kaya lang mas prevalent siya dun sa mga babae dahil sa menopause nga na tinatawag.
Yes. I will answer two points. Sa females, worldwide, 50% of females can get affected, especially after the age of menopause. Because estrogen plays a very important part sa maintenance ng bone mass natin for females. For males kasi, since they never have estrogen, ibang process yung pinagdadaanan. So, although in males, mas at a later time pa, pag elderly talaga because decrease din yung level of activity nila. May mga, yung diet, hindi na rin kasing rich in calcium, affected na rin yun. So, but yes, both male and female, yung population natin can get affected. Mas mataas lang ang prevalence sa babae, pero it doesn't mean na hindi maapektuhan ng male.
Dok, go. Ito yung normal bone cells tawag dito, di ba?
Normal component ng yung bone.
Okay. Ito
So
yung
normal masikip siya. When I explain it to our patients, mahirap kasing i-imagine.
You want to go
kasi,
here po, Dok? Sige po.
Sige, thank you. It's hard to imagine pag pinakitaan mo ng ganito. But this is how it looks like yung normal. Siksikan kasi maraming bone cells. Pag osteoporotic, lumuluwang yung bone cells.
Tsaka
lumalaki yung spaces in between.
Oo,
So,
mas darker.
I usually compare it for patients para mas maintindihan nila. May dalawa kang kahoy. Yung isa normal na kahoy, matigas. Yung isa normal looking pero may anay. Diba? So, yung may anay, pag galing tinignan mo from here, pareho lang sila halos ng itsura, pero masagi mo lang ng konti, tutumba na. And that's what usually happens with osteoporosis. They don't feel anything. Yung ano nga nito, manifestation, ibig sabihin kung ano yung nararamdaman ng pasyente para masabing may osteoporosis, halos wala. Bihira siyang idadiagnose na pag sinabing naglalakad, ay ikaw osteoporotic ka. Kadalasan nadadiagnose siya kung hindi dahil nagpa-x-ray para sa ibang condition, nabalian na. Pag nadulas, so a person without osteoporosis, kung mapaupo, masakit lang. Pero yung may osteoporosis, pag napaupo, may nababali na kagad na bone.
Ganun pala. What about yung normal curvature ng spine natin? Naapektuhan ba yon with an osteoporosis
Yes,
po?
it's one of the...
Yes po, Doc.
It's one of the parang indication sa atin, ano? Yung napapansin mo parang lumiliit.
Yes.
So, diretso.
Kumukuba, diba?
Kumukuba because what happens is kung nagkaroon na ng balik sa spine, tapos pag gumaling siya, hindi dun sa normal height niya. So, nakabagsak. And then, the other, kasi segments ang spine natin, so the other segments will follow that new alignment. So, pag at least one level or especially pag more than that, kaya nakikita natin yung mga elderly, pag nakukuba, ibig sabihin, may fractures na yung likod nila. Maybe old fractures, hindi nakita dati. It's just indicated by pain during that time na nangyari yon. And then, nung gumaling, medyo kumuba na sila kasi it will follow the new alignment. Kaya, hirap sila. So, basically, wala silang naramdaman until nangyari na yun.
What about yung epekto ng caffeine? Kasi sinasabi nila yung caffeine daw, pampahina daw yan ng bone. Totoo po ba yun, Doc?
Siguro, just like everything else, ano, pag too much.
Oh, in excess.
Pero, yung small amounts like 1 to 2 cups a day, hindi naman. Mas more important is making sure that there is adequate calcium in the diet. And different ages and different conditions require different doses of calcium.
And like you mentioned kanina, ang peak age natin is 20, doon
20,
nagpo-form yung mga
oo.
bones natin. So after, kailangan ba before 20, right after 20, nagtitake na tayo ng mga calcium supplements natin to help our
Well, not
bones?
necessarily in terms of supplementation, but more on diet.
Okay.
If we can get it from the regular, from natural dietary
So ano po ba yung mga recommended
pa rin.
nyo? Milk pa rin?
Milk pa rin ang mataas, dairy. Of course, medyo tricky kapag may mga patients na or tao na lactose intolerant.
Yes.
So, doon tayo na nagtitingin na ng alternative sources or supplementation. Green leafy vegetables have a lot, kaya lang, syempre, hindi kasing dami ng milk. But hindi lang dahil umiinom ka ng milk, okay ka na. Talagang may tamang dose.
Yes po.
So, for pregnant women, mas mataas ang requirement kasi meron ka pang...
Lordotic ka na pag ganun.
Aside from that, not necessarily just the alignment, pero yung metabolism kasi, so increase, tapos may isa pang nangangailangan din ng calcium aside from you. So, mataas up to about 1,200 milligrams a day.
Doc Maria, kanina may pinakita tayo dun sa ating visual. Meron siyang parang normal osteoporosis tapos merong severe na osteoporosis. Pag Doc, pag sinabi nating severe, may surgical procedure na ba dyan kapag sobrang painful na para sa isang patient?
No, it's more on medical treatment.
Okay.
The surgery comes with kung may bali na.
Okay.
And hindi din naman lahat ng nababalian necessarily has to undergo a surgical procedure. Most common yung sa hip.
Yes po.
Kasi para mas maigalaw natin yung patient kaagad. Pero otherwise, very severe osteoporosis, bihira din kasi ang may pain. Only a small portion of the patients will probably say, Dok, may masakit, ganyan. Kadalasan, it's either, yun nga, nabalian na, or if they see their doctors regularly, whether us, their endocrinologist, or sometimes yung mga OB, kasi postmenopausal, and our rheumatologists. So, maraming pwedeng tumulong sa kanila to diagnose that. It's diagnosed, yung pinaka-best is it's called DEXA, DEXA, so dual energy X-ray absorptiometry. Para ka din lang in X-ray nakahiga, pero ang tinitignan is yung density ng bone mo sa spine and then sa hip, because that's the two most common and debilitating fractures that is related to osteoporosis. Other common fracture sites, yung wrist. Kasi pag nadapa tayo,
ito yung pinantutungkod natin.
It's a protective mechanism, hindi natin yun maiiwasan.
Yes.
So, nakaprogram yun sa body natin. So, ito yung una, ito yung nababalian.
Opo.
Pagka napaupo, yung hip or yung back.
When it comes to fractures, no, na-mention niyo na rin, Doc. Like for example, bata pa yung isang, kunyari lalaki, di ba, hindi naman sila mas prone sa osteoporosis. Tapos nagkaroon sila ng fracture, kunyari dun sa hips nila by accident or by any sport, mas magiging prone na ba sila sa osteoporosis after that one, after the fracture? Accident?
No.
Yan. Hindi naman.
It's still ano pa rin, if it's treated right with the right management, kung kinakailangan ng surgery, yung tamang surgery for that. Kung hindi, yung tamang time para gumaling. But otherwise, if they return to activity after na-fix yung fracture at gumaling, malaki yung possibility na hindi. Kasi talagang walang one factor that will lead to osteoporosis. It's always an interplay of aside from the age, the diet, and the level of activity. So yung mga activities that has a lot of weight bearing, meaning nakatayo, naglalakad, tumatakbo, yan yung mga magagandang exercises na pangpatibay ng buto. Kasi bone responds to the stresses kaya siya lalong dumadami, may demand.
So exercise can strengthen it. Yeah.
Definitely.
Wow.
Pagka yung mga yung laging nakaupo, mas madaling
Mas brittle yung bones
mas prone
nila.
because less yung demand sa katawan. Swimming doesn't help a lot because it's non-weight.
Yes. Ayan, maraming salamat. Para sa mga iba pang impormasyon, pwede silang magtanong and consultations. Saan po nila kayo pwedeng tawagan, Doc?
Okay. I can be reached at 0917-500-3581.
And your hospital po, Doc?
St. Luke's Medical Center, both Global City and Quezon City.
Ayan, maraming salamat po, Dr. Maria Adelwisa Belen. Thank you so much.
Thank you very much.